One of my favorite articles of the last few years came out in JAMA, Internal Medicine 2014, and it was called Medical Cannabis Laws and Opiate Analgesic Overdose, Mortality in the United States, 1999 to 2010. The amazing thing about this article is it came out during the opiate epidemic, and people have called this the single greatest epidemic of our time. More people in the 25 to 45-year-old group died during this time than any other cause. Association does not necessarily mean causation, but what we do know from this study now is that states that have a medical marijuana law in place where medical marijuana is allowed, have less rates of opiate deaths when compared to the prior years. And the way the study was done is about as good as you can get. A more ideal study would be if you randomized, certain states would say, hey, we're going to allow medical marijuana in this state and we're going to, not allow it in this state and compare the two. Even that wouldn't be perfect because we know that, well, if you randomize it in Vermont, that might be much different than randomizing it in Florida, etc. So this is about as good as you can get. The problem with a study like this is the before and after, and a lot of other changes happened during that time. Now, what I mean by that is there were laws during that time to say, hey, physicians should prescribe less, etc. But you think that would have happened in the other states and the neighboring states, etc., where you didn't see a decrease. In fact, in some of those you saw an increase. If I was a physician and I was caring for somebody and they were an opiate user and I found out that they also had a medical marijuana card, some physicians might say, wow, this is going to kill you. You can't be mixing these two drugs. In fact, this study suggests just the opposite, that actually, perhaps, we don't know cause and effect with 100% certainty, but perhaps using medical marijuana, certainly in these states, actually decreased the death rate. So, as a practicing physician, if you told me that you were prescribing benzodiazepines to everybody who was on opiates, I would tell you that's ridiculous. That's going to cause more deaths. That's been shown time and time again. However, your question might be, will I cause more deaths if I allow my patient to use medical marijuana, etc.? And the answer to that probably is no. More study needs to be done in your individual setting, etc. But this is definitely, so far, the best study we have to say that it doesn't increase the death rate. In fact, it lowers it by a quarter. If you were a patient, and I was trying to tell this to you, if you were a patient and you were on long-term opiates, first I would tell you, try to get off the opiates, Opiates really don't work after about 3 days or so, unless you got chronic cancer pain. And if you try marijuana and it gets you off of the opiates, medical marijuana prescribed by a physician, etc. If you try to get you off the opiates, great, more power to you. I encourage it. I would recommend that you do that. I wouldn't worry that it's going to make things worse. I wouldn't worry that you're going to die from it. Of course, don't drive, don't operate machinery while you're on the influence of marijuana, etc. But for patients, I think this is a strong study to suggest that it doesn't make things worse. For lawmakers, they should read this study before they say we're not going to pass laws allowing medical marijuana because it's going to lead to more deaths, etc. And why do we want this? This is a study that suggests the opposite. So if you want to learn more about opiate addiction and medical marijuana or cannabis use to help treat that under the guidance of a physician, go to Blue Door Therapeutics at www.bluedoor.org.